And when they did the allergy testing, I remember thinking, this is it. We have figured it out. This is a smoking gun we have been looking for. Except it wasn't. I'm Dr. Robynne Chutkan, gastroenterologist, microbiome expert, and author, and I am here to help you find gut bliss. On today's show, the last in my gut skin series, and we are talking about atopic dermatitis, eczema. And I have a guest today in the Gut Bliss podcast studio, a special guest, someone who is very well known to me, my husband of over 20 years, Eric Mann. Welcome, Eric.
Hi, glad to be here.
Let me just point out that he is here under duress, not quite gun to the head, but there has been some encouragement. And part of that is because Eric has what I think is a really interesting skin story. So when did you first start noticing skin issues?
So about 12 years ago, I noticed that in meetings, usually after lunch, I would take my ring off and I find myself playing with my wedding ring during the meeting, like spinning it around on the table. And it took me a while to figure out that I was doing that because my finger was actually itching. So I was taking my ring off so I could scratch underneath my ring.
I remember commenting like, you're not wearing your ring a lot. And I'm like, okay, is this an allergic reaction to the ring or the marriage? But yeah, I mean, I could see under the
I thought
ring.
I was reacting to something in the ring, some metal. Not sure why it started all of a sudden because we'd been married for a few years by then. It just came out of nowhere.
Yep. And then after the rash under your finger, what was the next thing that you noticed?
So doing workouts, I noticed that my eyelids would become inflamed almost to the point where I would have to stop my workout, rinse my face, clear my eyes, finish my workout. I didn't think much of it at the time. I just thought it was my sweat, something in the hat I was wearing. I always wear a hat when I work out, and I just assumed that it was a chemical in my detergent that was running down in my face, or maybe something I was putting on my face, getting in my eyes.
I remember your eyelids were kind of swollen, and then you started to develop hyperpigmentation, like around your eyes. They were sort of dark and inflamed looking.
Yeah, I got worried because they began to be inflamed outside of working out. They just would get inflamed and just stay inflamed. So rinsing my face with cold water during the workout and washing my face afterwards didn't seem to clear it up anymore.
And then did you notice it anywhere else? So it started under your ring, and then it was the eyes, and then where else?
So eventually it got to the folds of my elbows and the areas behind my knees. And that's when things kind of became unbearable. I mean, the itching was so intense. I just needed relief.
And we went to see a dermatologist. I remember the first dermatologist. Well, you went, and I went along as the worried doctor wife. And she pretty much right away was like, oh, this is eczema, atopic dermatitis. And then you asked her a question.
Yeah, I said, well, what's causing it?
And she was kind of annoyed. Do you remember?
She seemed a little upset that I asked that question. And she said, it could be in anything. It could be in your wife's perfume. You were sitting right there. She said it could be in the ink in the newspaper. It could be the soap. It could be the detergent you're using. She made it sound like it was impossible to identify what it was that was causing the irritation.
Yeah, like it could literally be anything in the environment, and, let's focus on the treatment. What did she recommend?
She wrote me a steroid cream. And, I guess the plan was that I would have to use this, for the rest of my life since I didn't actually know what was causing it. But I wanted relief. So I took the prescription, got it filled, and started using steroid cream.
And did you get some relief from it?
Initially a little bit, but it would always come back. You could tell it was not solving the problem. It was just temporary relief.
And after a while, one of the things I noticed was that some of the lesions started to change. Like you had the sort of typical eczema lesions in the creases of your arms and behind your knees and your eyes, but then you develop these ulcers on your calves, these sort of ulcerated patches with raised edges that looked different. And I have to say, selfishly, I was worried that this was an infection. And I was like, I do not want to catch this infection where I'm, snuggled up to you in bed at night. Yeah, with the lesions. And so we went to see an infectious disease doctor, really lovely infectious disease doctor, a friend of mine. And she told you
that I had a staph infection on my skin. The bacteria amount was unusual, and that was likely causing the irritation.
Yeah, and she's absolutely correct in the sense that when we look at the population of people with eczema, we do see a really high rate of colonization with Staphylococcus aureus, a staph you referred to, more than the normal amount. And that colonization can lead to infection where you have more than the normal amount of Staph aureus, and it can lead to problems like methicillin-resistant Staph aureus, MRSA, which people with eczema can get. And what did she recommend for it?
She told me to try bleach baths, and she prescribed an antibiotic and another steroid cream.
Yeah, and I remember you filling the bathtub and putting the bleach in there, and I was like, this doesn't seem like a good idea, but you tried the bleach bath.
I was willing to try anything, and it didn't really work. Actually, the bleach seemed to irritate things more.
And I also recommended something that irritated things more. Do you remember what I told you to try?
Yes, of course. Tea tree oil.
Yeah, tea tree oil was like the worst possible idea.
It was like holding a lighter to my skin. Yeah. It was burning.
And in my Gutless Guide to Healthy Skin, which you can find at gutless.com under Gut Guides, it is in my ingredient list. It is one of the things that I tell you not to put on your skin if you have eczema or rosacea or anything like that. But I understand the rationale behind the infectious disease doctors recommending something like a bleach bath or even an antibiotic topical. And coming up, we're going to talk about the skin biome, the microbiome on the skin, and why an approach like bleach and antibiotics is often not a good idea. The Gut Bliss podcast is brought to you by VisBiome, my first and quite frankly, my only choice for a probiotic. Whether you're dealing with irritable bowel syndrome or just looking to restore your gut health, VisBiome can help. It's a medical food for the dietary management of IBS and gut inflammation. Backed by science and clinically vetted by thousands of my own patients. Find your gut bliss with VisBiome. Go to visbiome.com/gutbliss and use discount code GUTBLISS at checkout. The idea behind things like bleach baths and antibiotics for eczema is to try and kill off some of the Staph aureus. But just like bacterial imbalance in the gut, when we see things like SIBO, small intestinal bacterial overgrowth, it is not the additional bacteria that's a problem. It's a lack of healthy species. So when you don't have enough healthy bacteria in the gut, you see overgrowth of some of the less desirable species. And that imbalance is what we call dysbiosis. And we see dysbiosis in the gut, and we see dysbiosis on the skin. And we see a lot of dysbiosis in conditions like eczema and rosacea. With eczema, it's usually an overgrowth of Staph aureus, like you had. With rosacea, some experts think that having too many mites on the skin, specifically a kind of mite called Demodex, having too much Demodex can trigger a reaction and lead to rosacea. And what causes too many mites on the skin, too much Demodex? The same thing that causes too much Staph aureus in eczema. Excessive antibiotics, whether that's topical antibiotic creams or antibiotic pills, steroids, again, either steroid creams, steroid pills, any kind of immune suppression. Some people seem to have a bit of a genetic predisposition to this stuff. But again, I want to point out that Demodex, like Staph aureus, are a natural part of the skin flora. They are found in normal, healthy skin. But with conditions like rosacea and eczema, there is too much of it. There's excessive growth. So these skin conditions represent a form of dysbiosis on the skin, just like we see dysbiosis in the gut that can create a lot of different kinds of health problems, from kind of simple bloating and gas to small intestinal bacterial overgrowth to autoimmune problems. And the autoimmune part is because the composition and function of the microbiome modulates the immune system. It tells the immune system what to do. And so when the microbiome is messed up, the immune response is messed up. And we see similar things happening with the skin biome. So, Eric, what did you try next? So you've tried steroid creams, you've tried bleach baths, topical antibiotics, and some ill-advised tea tree oil. What happened next?
One doctor recommended that I put steroid cream on the spots and wrap it in saran wrap. So I had been doing that for a while, but that didn't work either. So my next thing, I went to an allergist, and the doctor did the basic allergy tests where they do this grid on your back and they test you against 50 of the most common elements that cause an allergic reaction.
Was any of it positive for you?
Yes, I actually discovered that I'm allergic to something called propylene glycol.
Yeah, propylene glycol is a common ingredient in the chemical and food industry and in sort of the personal care product industry. And some of these products can come into direct contact with the skin. And when that happens, that's a reaction we usually call contact dermatitis, which is a little bit different from atopic dermatitis. But I remember we went through all the products in the house, and there was quite a lot. Propylene glycol is in a lot of things.
Yeah, it's in just about anything you would put on your skin. It's in, shampoo, soap, lotion, moisturizer. It's in everything.
And remember, we thought, okay, this is it, the smoking gun. We found the answer. Except,
we replaced everything in the house that had propylene glycol in it, and unfortunately, it didn't work. I didn't respond to it at all.
Yeah, I think that maybe things got a little better, but then they'd get bad again, and you were still getting new lesions. And then we went to see another dermatologist. So you'd seen a dermatologist, you'd seen 2 infectious disease doctors, you'd seen an allergist, and then here's where I have to give a shout out to this doctor, my good friend, Dr. Paula Borelli, a wonderful dermatologist in Olney, Maryland. And she did something none of the other doctors had done, actually. She took a culture from one of your skin lesions, from one of those sort of ulcerated lesions on the calf, and she looked at it under the microscope. And do you remember what she saw?
I do. She said, you have yeast growing.
She saw Candida, and likely a result of all the steroid creams you had been on. So again, it's not the yeast that was causing the problem, but they were a side effect of the steroids. You had overgrowth of yeast, and that was contributing to some of the severe lesions on the legs. And she was the first person who suggested an antifungal because of all the yeast she was seeing in the leg ulcers. And she gave you some antifungal cream and maybe, I think, some pills to take that helped to get those under control. But it still wasn't better. The ulcerated stuff had cleared up a little bit, but you still had pretty bad eczema.
Yeah, I'm still suffering.
Yeah. And I recommended an elimination diet because I remember thinking it's got to be dairy. There's a strong association with childhood eczema and dairy, where dairy can trigger eczema in children. Very common association. And even though you were not a child, I was thinking, well, it's got to be dairy. We should try dairy. And you did an elimination diet. You took out dairy for about a month. And what happened?
Well, I took out more than dairy. I took out everything. For a couple of weeks, I was only eating white rice and fish, steamed fish with nothing on it. And I began to introduce different items, one at a time. But I didn't really respond to taking out dairy at all. It had no effect.
Yeah, so you did a classic elimination diet. Sometimes people will do sort of rice and turkey, or usually it's just something bland, like a plain grain like rice and a simple protein. But what did make a difference? Because ultimately, this is how we landed on the solution to all of this. So what was it?
Once I reintroduced bread and pasta and things like that, I began to react again. My eczema had cleared up for the most part during the duration of the elimination diet. When I started eating bread and stuff like that again, it came back. So you concluded it was gluten.
Yeah, it was gluten, and it was pretty clearly gluten. And our daughter, Sydney, always talks about the good old days. She's like, remember when we used to eat baguettes and we would have an occasional croissant or a piece of toast at breakfast? And she talks longingly about the gluten days. And you occasionally will have something, right? I feel like you're about 90% gluten-free.
Yeah, I am. I'm not allergic to it, but apparently it's associated with my my eczema condition. So I avoid it most of the time. Occasionally I have a beer, or some bread, if we're traveling or something like that. But I always go back to my diet.
Yeah, because
after eating, a nice baguette or having a good cold beer or something, I'll notice my ring finger is itching again, or some other little patch on my body is becoming itchy and scaly. So now that I know what it is, I just stop eating it and go back to my normal diet.
Has that controlled it 100%, or are there other things that you still do sometimes for it?
No, that's about it. I mean, occasionally, if we're traveling and I overdo it with gluten, I might have to use a little bit of steroids and antifungal cream together to get things under control again, but it's nowhere near what it used to be.
Yeah, I remember one day in that first year, we were getting ready to go out and your skin was on fire. I mean, the eyes were bad, the creases of the arms, the back of the knees, the calves were itching and burning, and you were trying not to scratch. And I remember you saying to me, "Can't you do something?" And it was just like, I don't know what to do. And I want to point out here that although some of the things the doctors recommended were not helpful, the bleach baths, one of the doctors wanted to prescribe a topical chemotherapy cream, tacrolimus. And I'm familiar with tacrolimus because as a gastroenterologist, we use that drug, an oral form of it, in people who've had liver transplants. It's a really strong immune suppressing drug. And I thought, okay, no way this can be a good idea, even though the clinical data show that tacrolimus can be really successful and effective in people who have hard to treat atopic dermatitis, eczema. But it just seemed to me that this was kind of a drastic, medication to use. But what I want to say is I am grateful to all the doctors that you saw, and we saw them together, because every single one of them tried to help you. They were all doing the best with what they know and the tools they use. And sometimes these things work really well for people. And I appreciate that. And I also am so glad that your skin is better.
Yeah. Glad to be where I am.
So I want to leave you, as usual, with 3 takeaways. Number 1, if you are struggling with a skin condition, whether it's eczema or psoriasis or rosacea, it's not that the answer is always going to be, just do an elimination diet and, you'll see the culprit is dairy or gluten or some other food that you're eating. What I want to leave you with is the idea that you should keep searching for answers. What is your body, and in this case, what is your skin trying to tell you? Is it a food that you're eating? Is it a product you're using? Is it a medication you've taken that may have caused some damage? And sometimes these questions don't have answers, but we always still want to ask them. We want to ask them of ourselves and of our doctors, and we want to look for answers. Number 2, sometimes a medication that you're prescribed for a condition can help, but it can also create another problem down the road. The steroid cream did eventually help Eric's lesions, but they created this additional problem of yeast overgrowth and ultimately more severe lesions. And that is often the case with things like antibiotics and steroids. They can temporarily clear things up, but they can lead to more disruption of the microbiome, which can cause more problems. And finally, remember that after your GI tract, your skin is your body's second largest digestive organ. Your skin literally eats what you put on it. It absorbs it into your body. So if you have a disrupted skin barrier, you have to be really careful about what you are putting on your skin. Leaky skin is a real thing, just like leaky gut. Leaky gut is an intestinal barrier that is more permeable than normal, and leaky skin is a skin barrier that is more permeable than normal. And it can allow chemicals into your body, and those chemicals can trigger an immune reaction. So that's it for this edition of the Gut Bliss podcast on atopic dermatitis, otherwise known as eczema. This is the last episode in my gut skin series. Optimizing the bacteria in your gut is critical to achieving healthy skin. So if you have tried the prescription creams, gels, and pills, and you still aren't getting any relief, it may be time to try a different approach. The Gutless Guide to Healthy Skin is a comprehensive resource that I've put together for you with over 70 pages of skin do's and don'ts, a product ingredient guide, edible skincare recipes you can whip up in the kitchen, healthy skin diet, what to eliminate, what to add in. You can find it all at gutbliss.com under Gut Guides. Coming up next week on the Gutless Podcast, clean, green, and schmerry. How to have better wipes. Next week is all about stool nirvana, baby. Go to gutbliss.com for my free 7-day microbiome reboot course. If you like what you're hearing, drop a review and hit that subscribe button. And remember, dirt, sweat, vegetables, the best prescription for a healthy gut.
The information presented in this show is not meant to be medical advice. Consult your doctor before making any decisions about your health. The patients discussed are real people, but names and identifying features have been changed to protect their privacy.